So we know there are 5 suspected cases and 1 confirmed case. The confirmed case is of a British man who is in intensive care in a hospital in Johannesburg. The 5 suspected cases include 3 deaths, 2 of a Dutch couple, a man who was 70 and a woman who was 69. They're a married couple. The man died after falling suddenly ill and arriving at St Helena. And the woman, the 69-year-old woman, collapsed at an airport in Johannesburg on her way to catch a flight to get home back to the Netherlands, and then later died in hospital. A 3rd passenger also died, but we don't have details about that person. And 2 crew members are presenting with symptoms. This is a really tricky situation for both the Cape Verde authorities, but also the cruise operator, because the Cape Verde authorities obviously keen to keep this contained on that cruise, aren't allowing passengers or even the affected patients to disembark. The ship, the operator is saying that 2 people need urgent medical attention. This is what they've said. They said a strain of Hantavirus has been identified in 1 passenger who was previously medically evacuated from the vessel and is currently being treated in intensive care in Johannesburg. At this stage, it has not been established whether Hantavirus is linked to the 3 deaths connected to this voyage. Hantavirus has not been confirmed in the 2 symptomatic individuals currently on board. The exact cause and any possible connection are under investigation, and we are currently establishing the full facts and working on appropriate medical care, screening and next steps. So that's what Oceanside Expedition said. They're the ones who run this Dutch flagged vessel. Let's go through about the route of this cruise ship. It set sail from Argentina, then it docked in St Helena. This is where the first gentleman died. Then it went to Accession Island before arriving in Cape Verde. So passengers have already been on board this vessel for a number of days, and you can imagine just how frustrated they'd be being now stuck on this vessel, not being able to move. Perhaps supplies are running short. We don't know if they're in quarantine conditions or anything like that, but no doubt those are the kind of things that the shipping operator will be keen to explore. Hantavirus is spread, as you say, through the droppings of infected rodents, and it attacks people very quickly. It can be fatal. It attacks the kidneys and the lungs, and we heard a lot about it last year when the actor Gene Hackman and his wife were found dead in their home because his wife, later it was discovered, had Hantavirus. We've been speaking to a cruise health expert. Have a listen to what he said.
Mode of transmission is really through rodent, either droppings or aerosolized virus particles from the rack droppings or the urine or other things. And so, you know, if you've got mice or rats on a cruise ship, and particularly if the company isn't really vigilant in rodent control and sanitizing surfaces and segregating passengers from any droppings, it can be, you know, very dangerous.
Well, we don't know exactly what the cause of this outbreak is. The shipping company very keen to just emphasise on that, but we know that there are about 170 passengers that can be on board this vessel. They're situated in 80 different cabins, so quite closely connected to each other, and very concerning situation. And I should add, the Foreign Office has said that it is closely monitoring the situation.
Yeah, it'd be interesting to see how long they're stuck on the ship now. Sadia, thank you so much for the update.